So picking back up, like I mentioned, there are many ethical decision-making models that share some common aspects or common steps. And here are those common steps. And you're going to be creating an ethical dilemma as part of your signature assignment and having to follow one of the many ethical decision-making models. And so all of you are going to be doing these steps. You may be doing a couple of extra steps, but you're going to be doing these steps. You're going to identify and define the problem. You're going to involve the client. You should not be making decisions about and for clients without their involvement. That goes back to the concept of autonomy, right? And making sure that you're including them in all these different steps and allowing them to be part of this process. You're going to review relevant codes and literature. It would be very inappropriate for you to reference old codes or outdated research and literature. That goes without saying. Consider your principles, consider your virtues, consider those things that are really important. And are they getting in the way of you being able to make an appropriate decision? Or are there any other sort of principles and virtues that might need to be considered? Tune into your feelings. How do you feel about the situation? This is very important. We talk a lot about sort of gut feeling or gut instinct. And oftentimes you'll hear in counseling when you seek consultation or supervision around a dilemma or a matter, someone that you're consulting with may say, how do you feel? What does your gut tell you? And then you'll see in very big, bold letters, consult, consult, consult. It is imperative that we talk professionally in this industry. We communicate, we engage, we share thoughts, we share ideas. There's not much that we can really talk about with other people because of the nature of confidentiality and what our clients tell us about. But we can consult, of course, in a very meaningful and confidential way, but we can consult with colleagues, and it is imperative. It is an obligation that you consult. Consider the context. Have you considered this cannot be, we can't look at all ethical dilemmas or situations as either or. You have to consider cultural aspects. You have to consider just sort of every possible avenue or thing to consider about this dilemma, about this client that you could possibly consider in order to make the best decision. And then, of course, you need to consider the possible outcomes and what are the actions to achieve all of these different outcomes. And then choose an act. Make a decision and do it. And finally, at the very bottom, document, 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 document. Write all these things down and keep them, of course, in a safe and secure place. Following through, or just sort of continuing on through our textbook, legal issues. So oftentimes you may be faced with ethical and legal issues, and they might happen simultaneously. Ethical situations and clinical judgment may also involve, like I said, some sort of legal matters that now we're talking about ethics and the law. And so what do? Seek legal advice if at all possible. If your company offers legal advice, take that offer, take them up on that offer, and reach out to attorneys who are skilled and knowledgeable on counseling law. If you have liability insurance, then your liability insurance may also provide legal advice. If you're an ACA member, ACA members can seek legal advice as well, or they can seek guidance, not necessarily legal advice, but they can seek guidance. But certainly through your agency that you're working for, and then your liability insurance should be able to help you out. Seek advice from a supervisor or an upper administrator. If a supervisor or an upper administrator tells you what to do, regardless of whether you agree with it, you write it down. You write down that they told you to do this. You write the date down, and then you do it. That doesn't mean that, if you do this and something bad happens, then you have documentation that you were told by somebody in a higher position or higher authority or higher pay grade told you to do it. So, again, this is where one of this is going to feel a little icky, but you want to make sure that you're covering your bases as well. And so making sure that you document that you were told to do something is covering those bases. And if you can give away the dilemma, if you can give away the problem, then do so. If you don't need to involve yourself in a situation, and the book gives you some examples, if you don't need to involve yourself in a situation, by all means, do not. Give away that pickle. Give away that dilemma. Give away that issue and allow someone else to do it. And of course, I have at the bottom, document, document, document. I don't have consult on here because you may not be able to consult about some legal matter. You may be prevented from doing so. And also, and your book describes this as well, but a lawyer is not going to be the best person for you to consult with about a counseling issue. They're going to be someone to seek legal advice and guidance from, but not necessarily consult. It's a little bit different. When you have to use professional or clinical judgment. So maybe it's a little bit of a dilemma, but you have, or whatever the case may be, but it's not necessarily legal. There's not a legal aspect or a legal issue involved here. Professional and clinical judgments, this is your job. You're going to be making clinical judgments and professional judgments every single day. That may be whether or not to, is someone suicidal, and do you feel that this person is at so much risk that you need to involve police officers or call an ambulance or contact their emergency contacts. Making these types of judgments, this is your job. There may not be a right answer or a wrong answer, and it may not be very clear, or that those answers may not be clear. Know that you're responsible for those decisions and any harm it may potentially do, so you need to be very careful in your thought process. And of course, maintain liability insurance. Here I have consult, and I have document. Always do not operate as a counselor inside of a bubble. Always consult. Always engage in this professional obligation of consultation that you have. You're going to be under so much supervision for the first several years, but it's still important and still very relevant for you to consult. And then, of course, documenting we're going to talk about documentation, and we're going to practice documenting and note-taking, but this is really, really, really important as well. Okay, so that's all the slides. I might touch on this just briefly when we meet, just to see if there's any questions about this chapter before we talk about chapter 2, but I just kind of wanted to provide a lecture for you guys, since we're not meeting this first week.